Hi, my name is Brian Jones. I am the owner and lead psychotherapist of the Mindful Self Psychotherapy Services. I wanted to talk to you today about a very important issue concerning diagnoses and how people are diagnosed. The purpose of doing this is to really attempt to clarify to the general public about the process in which diagnoses occur. Many times I have clients that come into my office and say, I have borderline personality disorder, I have bipolar disorder. And of course, I would say, well, were you diagnosed this by a psychiatrist, a doctor, general practitioner, whatever? And many times clients say to me, no, I looked it up on the internet and it seemed to fit. Well, I wanted to help to clarify these kind of concepts because ultimately this can sometimes prove to be more harmful than good. Well, before we can talk about diagnoses though, and in this video I will talk a little bit more about normal versus abnormal behavior. Because in order to diagnose, we have to know what's normal for a person versus what's abnormal. When we talk about normal, it becomes tricky because we get into the large philosophical debate of normal, what's normal? Is it socially acceptable, which is normal? Which is it something that our parents deem as normal? Is it what we deem as normal? Well, in this case here, what we mean by normal behavior, it's really the day-to-day functioning of a human being. This could have cultural implications, social implications, parental. It could mean, normal for a certain period of time, a developmental normal. It doesn't matter, but it just means that there is a certain level of functioning that is considered functional for the individual. So on the other hand, then we have what's called abnormal behavior. Abnormal behavior is that which is not functional for the individual. In the area of diagnostics, then we take it a little bit further and say what provides a harmful dysfunction. Because dysfunction could mean, let's say, the death of a loved one, right? That's a little bit of a dysfunction right now because it interrupts your day to day life. But then when it becomes a harmful dysfunction, now we must begin to assess clinical utility or clinical valence. So let's take a look at this right here. What do we mean by mental disorder? According to the Diagnostic and Statistical Manual, the fifth edition, developed by the American Psychiatric Association, which is a book used by many clinicians around the world. What we want to do is attempt to understand what we mean by this and how psychiatrists, psychologists, clinicians, therapists, psychotherapists, counselors all have the ability to make these kind of decisions. Well, in accordance with this, a mental disorder is described as a mental disorder is a syndrome characterized by clinically significant disturbance in an individual's cognition, emotional regulation, and behavior that reflects a dysfunction in the psychological, biological, or developmental processes underlying mental functioning. Mental disorders are usually associated with significant distress or disability in social, occupational, and other important activities. Now, when we're talking about this, we're talking about disruption in your cognitive, behavioral, and emotional life, the way you think, the way you feel, and the way you act. So this is all about you. It's an individualistic way of thinking. But now there's an addendum to that, which we would have to say in cases of cultural significance. So sometimes there are some cultures who practice a certain ritual or behaviors that are not conducive to, let's say, Western standards or European standards. So in this case here, we don't want to diagnose something that is in just because it's inconsistent with our cultural standards. In fact, the idea is to understand those to say what is that individual norm and how does it conflict with their own way of living. When clinicians attempt to diagnose a person, we take all of these things into consideration. Now, what is abnormal behavior? Well, first, we want to say abnormal behavior is not something that can happen to anyone at any moment, anytime. So let's say, for example, a loved one dies. Your grief is not diagnosable, nor does it have clinical utility or clinical significance. But your grief can turn into depression if it interrupts your everyday mode of functioning over a period of time. Now, I need to emphasize this over a period of time because later on I will talk about the length of time symptoms persist and how that becomes important to the diagnostic process. But in this case here, I just want to point out that, we can't look at one moment in life and say, this is the case, therefore I have a depression, I have some kind of mental disorder. Remember, mental disorders are not characterized by the way they present to, just because it feels right. It's presented because we need a common language. Clinicians need a common language to communicate with other clinicians. And in this case here, the mental disorders allows us to say depression. And now depression means there's a set of criteria in which allows us to give a clearly defined definition for how the person views the world or what types of dysfunctions this person currently has. So I'm going to end on that note there. But what I want to end with is this idea that I want people to be more aware about how they're talking about mental disorders. It's very often that we hear people talk about anxiety, depression, and not quite clear on the definition of what that means. While I'm not going to go through every single type of diagnoses in the DSM or the ICD, what I will do is try to help you to understand more and more that these types of diagnoses require a lot more attention than what the media attempts to give it. Please, if you have any questions, I'm more than happy to answer questions and discuss a little bit further, either in the forum here on the comment section, or you can email me at inquiry@themindfulself.co.uk. Alright, until next time, stay good health.